Kaveri Hospital have been at the forefront of cutting-edge treatments over the last few years, and especially in the last 3 to 4 years, Kaveri Hospital has been focusing more on quaternary health care, especially cardiovascular and neurovascular diseases. From a cardiovascular perspective, Kaveri Hospital has been at the forefront with the most advanced technologies. As a result, today it has bloomed into a center of excellence for advanced cardiovascular and hybrid techniques. We're very fortunate here at Kaveri Hospital to have India's first state-of-the-art hybrid OR encompassing the Philips FlexArm hybrid operating room for the first time in the country. Now, with healthcare, you need a one-stop facility where anything and everything in the world can be delivered safely in the best possible manner towards the best possible outcome. And that is what a hybrid OR facility delivers, which is we have anything and everything required to deliver any heart treatment in one spot. For the heart and blood vessel treatment, we are fortunate here to have the Philips FlexArm system. Along with that, we are equipped with intravascular ultrasound. We are also equipped with optical coherence tomography or OCT. These are imaging systems which allows us to see inside the blood vessels rather than conventionally go by shadows, which is what angiograms do. In addition, we have rotablation, which involves churning of very hard calcium particles within the blood vessels. And also we have the Philips Spectranetics laser Atherectomy system for the first time in the country, where laser is used to open up blood vessels, thereby allowing these patients having angioplasties without the requirement for bypass operation.
We are really excited to bring this Philips FlexArm system and have the first installation in India. And I'm definitely sure my surgical colleagues, the vascular surgeons, the cardiologists, the interventional cardiologists, and the interventional radiologists as well will all be using it to its fullest and make this as a center of excellence in the world.
This hybrid FlexArm system allows various treatments that had to be conventionally done in an operating room. Now, one of the treatments that we do is changing valves without surgery. Patients had to have open heart surgery in the past. Now, we can change all these valves without surgery. This is called transcatheteric valve implantation or replacement, abbreviated as TAVR or TAVI. The safest place worldwide to deliver such treatments is a hybrid OR, and we're very fortunate to have this hybrid OR. In this Philips FlexArm hybrid OR, we have the echo navigator, whereby simultaneously the echo image is superimposed on the patient's fluoro, whereby we have continuous orientation of where the catheter or the kit is moving within the body on fluoroscopy. It also has the vessel navigator, which is a great tool for endovascular procedures, whereby the patient's CT scan is superimposed on the fluoro screen of the patient, and as you move the fluoro screen, the CT scan being embedded also moves exactly in the orientation of the fluoro or the patient. This allows very safe treatment delivery and orientation for the endovascular specialist to be able to treat with better outcomes. One of the important aspects of our hybrid OR, especially the Philips FlexArm system, is that it allows a lot of room for various specialists to simultaneously work on the patient. And that's the whole point of hybrid procedures. What this involves is various specialists, cardiac surgeons, imaging cardiologists, cardiac anesthesiologists, and endovascular specialists like myself work simultaneously on the patient to deliver the best care. As a result of this requirement, the entire FlexArm system is designed in such a way that all these specialists can bring in their equipment that does not interfere with the cath lab equipment. That is the beauty of the entire design. Not only that, as soon as we want to convert an endovascular into an open procedure, the patient stays in the same table, and the flex arm completely moves out of the way, and then we are able to do a full surgical procedure.
In Kaveri Hospital, I'm sure we will be able to offer endovascular solutions combined with open surgery. There are a lot more patients, and I'm sure patients are going to be benefited greatly by this machine.
This hybrid OR is all about image-guided therapy, whereby the patient's image in the form of CT or ultrasound is actually embedded on the fluoroscopic screens, whereby most treatments can now be delivered with this integration very safely, and intuitively it tends to give better outcomes, and we're very glad about that.